If you have hearing issues, Albuquerque Speech, Language, and Hearing Center can help. Today I got a chance to go behind the scenes and get a real example of what hearing loss sounds like. Well, Dr. Sanchez, thanks for having me out to talk about this very important subject today, hearing loss.
Thank you. Thanks for coming.
So it affects a lot of people, hearing loss does. Tell me some of the early signs of hearing loss.
Well, one of the most common signs, especially around this time of year, is when the family gathers, you're just not quite getting the message. The noise just tends to drown out the voices and you're not really picking up on the conversation. So that's one of the earliest signs. And
these are people who would normally hear in a setting like this where there's no background noise. Then suddenly you have a party and you can't.
Right. In a quiet situation, we tend to hear a lot of the sounds, even though we have maybe some high frequency hearing loss, we're getting enough of the other sounds that you can make sense of the message. When that noise comes in, you lose some of those critical sounds and you can't hear.
So something to look out for.
Right.
If you catch it early enough, that's obviously better.
Well, sure. You want to treat it, not just catch it. You want to treat it because there are hearing aids now that are very sophisticated that can really help you to hear better in those types of situations.
And they're hearing aids that I assume are not like what we're used to from 20, 30 years ago. They're
Right.
something a lot more compact and maybe even pleasant to the eye.
Right. They're very cosmetically appealing and really just more sophisticated in terms of the sound quality and also the ability to use auxiliary accessories that can help you hear in those challenging environments.
And doctor, you brought this machine today because you wanted to show us an example of hearing loss.
Right, so this is a very common degree of hearing loss. It's sort of a mild to moderate high frequency loss.
Okay.
And first we're going to talk about how a person with normal hearing might hear this average voice.
Okay, so you're not going to be able to do this, is that what you're telling them?
I'm telling you that's probably.
So that's pretty normal. And this is what the person would hear if they had this hearing loss.
Okay, so you're not going to be able to do this, is that what you're telling them?
I'm telling you that's probably what I'm going to do.
Wow, that's significant. That's a major change. So that means communication is out the door, that means quality of life is out the door, so it's very important to get treated.
Right, and this happens so very gradually that most patients just don't realize how significant it is because it's happened over many, many years. So we would encourage anybody, if you know somebody who has hearing loss or is showing the signs, to have their hearing checked.
So if someone does have hearing loss or at least signs of it and they're getting treatment, what are some steps they can take to make their quality of life better?
Well, if you don't have hearing aids and you're going to Thanksgiving dinner next week or for Christmas, what you're going to want to do is reduce the amount of noise around you, turn off the television in the room, use good lighting because we all lip read to some extent. And so if you can see the person's face, you're going to hear better. And really be an advocate for yourself and explain to others that you're having some trouble and ask them to rephrase if you're not understanding what they're originally saying. And
especially at this time of year because you're talking about family members that are coming in from out of town and they may not have seen that gradual progression.
Right, right. So you just have to, it's an invisible impairment. You can't see that something's wrong. So you really have to address it and hopefully get some help.
And I guess the family members too have to be sensitive to an issue like this, speak more clearly, articulate better, and make sure the point gets across.
Right. Well, if you can look at the person and reduce as much noise as possible, they'll be able to participate much better.
Okay, well doctor, great information and thanks for showing us this demo. It was very eye-opening.
You're welcome. Thanks for coming.
No problem. Albuquerque Speech, Language, and Hearing Center is located at 9500 Montgomery Northeast. To learn more about their services or to make an appointment, call 247-42